Hello, and a very warm welcome to this Explain Pain in the Clinic. My name is Joanna Taylor. I am Director of NOI in Europe, and I am joined this morning by my very good friend and Principal NOI Teacher, Tim Beams. Morning, Tim.
Morning.
Tim has been a NOI teacher for over 15 years, and he has taught literally hundreds of Explain Pain courses to thousands of clinicians all over the world. Tim is an active clinician himself, specialising in complex and persistent pain. And he is also founder of an organisation called Pub Scientifique, which is an online platform for clinicians to learn about the latest developments in clinical practice and pain research directly from pain specialists. He is also co-author of the GMI Handbook with David Butler and Lorimer Moseley. Welcome, Tim. These sessions, these Explain Pain in the Clinic sessions, are all about exploring how to practically use Explain Pain in the clinic. Some of you joining us today will have already done an Explain Pain course. And so these sessions are designed to both reinforce what you've already learned and to expand what you will have covered in the courses. And for some people, this may be your first time, and this may be a complete introduction. So this will give you an idea of what Explain Pain is all about. So just a couple of things to mention before we start. Tim will be talking for about 20 to 25 minutes. If you have any questions, please pop them in the Q&A or the chat. Tim and I will both monitor those as the session progresses. If you want to watch the recording of this session, you can access it in the NOI Clinical Discussion Group. I will drop the link for that into the chat in just a minute when Tim starts. It's a Facebook group, and I would urge you to come and join. It's brilliant. There's loads of NOI clinicians in there on hand to answer questions. They're posting content, and they're posting really interesting clinical stories, and it's a really active community. So please do come over and join. We'd love to have you in there. So I think we'll kick off today with today's session. We're talking about pain treatment versus pain management. So Tim, where would you like to start with this? Let's go.
Morning everyone. Great to see you all. We came up with this idea, or we came up with the topic based on some of, I think, sort of fairly recent interactions that I've had with people, and so clinicians and patients actually. And so the place I'd like to start is just what their expectations are. So in other words, what they hear when you say pain management versus pain treatment. And so if I ask my patients, for instance, about pain management, and certainly what I've heard in the past when I've run programs that have been called a pain management program, is that the understanding and expectations of a healthcare professional versus someone in pain, it can be very, very different. So that's the first thing to say. It's really about someone's expectations around wording. And what I have experienced, and it will be really interesting to hear what other people in this session have experienced, what I've experienced, not from everybody, but from some people, is when you hear the term management, they get an impression that things are going to be quite passive. So are you just going to tell me how to manage my pain? And to be fair, that might be how someone delivers the introduction around a session as well. This is a pain management program. We're not here to change your pain. We're just here to show you techniques and help you to understand how better to live with your pain. So it can be quite, I think if I was on the receiving end of a message delivered like that, it really does take away the hope or optimism that I personally feel we should be able to deliver. So coming back to what I was originally saying, the notion of what someone hears within that messaging, I think, is really, really key. And I literally, just before we came on, I've had a message from a patient, and her question, I think, is fairly typical from many of our patients. And the question read something like, I forgot to ask you yesterday, but given what I'm doing and what I'm experiencing, do you think that my pain will reduce, or do you think my pain will go away, or do you think my pain will get better? I'd have to read it again to hear exactly what she said. And people want to know that, don't they? They want to come, they seek help. And I think there's something huge about that. What the motivating factor is that when someone is in pain to such an extent that they actually go and seek help, that really says something about what they're experiencing. And what it says to me, like, there's a fundamental notion of what that says to me, is that they've probably tried many different things themselves. They have got loads of knowledge and understanding and experience over the years that they've been alive, and they've put that into practice, and that hasn't been effective this time. And I think as a healthcare practitioner, as someone treating someone in pain, that's something that I need to recognize straight away. What is it that moves someone to take the action to come to see me? And unless I sort of get rid of all the baggage that I've got and open up myself to why someone is here, then I'm really missing it. I'm missing something for them. A long-winded answer about why we said that.
I think it's a very important point, actually, Tim, because from what, if I can just summarize what I've heard from you there, that actually, so first of all, that patients and clinicians tend to hold slightly different interpretations of the words management and treatment. And from a patient perspective, using the word management suggests inaction and a passiveness around what's going to happen. Is that right?
I think so. And as I said, it's not always the case, and it does depend on the individual. And even if you sort of go back to the roots of the English language in this, that manage often can be difficult to manage as well. So, and then manage is like a passive process, and not if you are the manager, if you're planning, organizing, structuring, etc., and controlling for various things within your department, then clearly that is very active. So I think it does depend on also your experiences of whatever management might be. Treatment, on the other hand, goes hand in hand. I mean, you don't need to explore very far to look at what pain treatment might consist of. That pain, and someone's thinking that we're doing something actively to help the illness, the injury, etc., that someone presents with. And from a societal point of view, certainly from the society that we and culture that we've been brought up in, that treatment often is synonymous with fairly passive approaches, passive interventional approaches, like surgery, injections, medication. It can include psychological interventions, exercise, etc. Absolutely, but that's not necessarily at the tip of someone's tongue when they are thinking about and talking about what treatment is versus management.
And actually, that ties in exactly with what Miriam has just put in the Q&A, where she says treatment could also mean that the patient is being treated and does not have to be active. So a question here, Tim, in your clinic with your patients, what do you elaborate on? What term do you use? And then do you then discuss what this means?
Well, no, I don't use a term. I don't have like Tim's favorite term to use that comes out every time. It's something that we're discussing at an individual level. So it's figuring out unified, like, common ground that we're then going to use together. I mean, I would like I think an important part of this process is, let's say an expectation is being more or less passive or active in a particular phase of your treatment or recovery. And that is something that I do spend some time talking to people about, because there is a time and a place where someone is in so much pain that it is difficult to strategize, plan, analyze, figure out, take the right decisions or make decisions relating to the pain that you're experiencing. In which case, if we recognize that that can be a feature of someone at a particular time and place, then we may be doing very much more for them at that time, perhaps giving them more suggestions, problem solving. Perhaps we take a little bit more of a lead in that process. So it might look like someone is much less autonomous, much more passive in the process, but that's not necessarily how they're going to stay. And I think a more up to date. I mean, I'm saying up to date, but the reality is we could go back 50 years and people were writing about this in the mid 70s, absolutely for sure, about working together to give someone the skills, the understanding, the knowledge that they always have. In other words, the health literacy skills, so that they can make the right decisions at the right time, or better decisions at the right time. But there is a time and a point when perhaps we take a bit more of a lead, and then the hope ultimately, and certainly what we see in research looking at the delivery of treatment processes for people with persistent pain, is that then the hope is that they become more of an active part or more of an autonomous agent in the process of their health.
Okay, thank you. I think we'll probably move in this direction now with the conversation. But just before we do, and there is always a lot of there's a question in the Q&A which says, could Tim suggest what would be the best suitable terminology to use? Now, and I think this is quite important, because there's a lot of confusion around words and whether it's okay to say something, whether it's, whether you shouldn't say something because the inference is, taking somebody in the wrong direction. And you've been talking here about that you discuss these things with your patients. Do you discuss terms that they may be familiar with, like management and treatment, and what that means to the individual?
Yeah, I did see Rosie mentioned about pain coaching. I mean, I was speaking with a patient last night, and I dropped a question in, and her response was, "I knew you were going to ask me about that." And I would just probe. I just create. Like in my mind, I have this notion of being just curious. So if there's something that crops up, and I would just be the curious person there, just going, "Oh, that's interesting. Oh, can you tell me a little more about that?" Or "Well, what does that mean to you?" Or "How do you feel having heard that?" Or "People keep telling you about this," and so that's how I might open up conversation around the topic. So if it was about management, then I would do exactly that. So
do you actually refer to management, treatment? Do you actually use those words in your consultations?
Not where possible.
Right. I think that's the answer that people were after.
but there is, like, people come to see me and I'm working almost entirely online. And there are expectations that because we're talking remotely, that how can I possibly do something for them? And it really is an important part of the sort of a relationship, is that as we are discussing and we're building and we're making sense of something, then they see value in the process of working together. And that is something that I actually do spend quite a lot of time discussing and asking and checking in about as well. So I mean, these are very slightly off topic, but I think are relevant, is that I do set out my expectations. I do ask their expectations of our time together. We create appropriate boundaries. We check in, and these are all sort of, if you want, procedural parts of what I would do with someone.
It's not really off topic, Tim, because it's really on topic. This is we've done a session, haven't we? We've done sessions around this questioning and answering, and please do go and check out the previous sessions that Tim's done on asking good questions and conversation with your patients and how to get the most out of those conversations. They're in the clinical discussion group. But this is very much the approach that Tim and Explain Pain takes, isn't it? That it's not just do this, do this, do this. It's a much more fluid process that you're in with each individual patient.
It totally, yeah. Not everybody is at the right place at a particular, to start with, to be able to adopt that. So there are times when you perhaps take the lead a little bit more. And I was saying thinking about pain and how all consume it can be for someone when they're in pain, is that they don't have the capacity to be able to think and strategize and plan and so there are times, and even if you think about that going forward as well, there is a load on the process of being able to do that. I mean, if you want to call it a cognitive load, but there's energy expended in the planning and what have you process of my day, my week, my month, and actually spending some time together working through that might allow someone to just let go of some of that load that they constantly carry with them as well. So yeah, and to me that is management. That is pain management, but I would say in a more optimistic, with some optimistic messaging around that, that if we lighten the load a bit, we're creating room for other things. So let's bring something else back into your life that you've been missing or would make you feel richer and nourish you and things.
Thank you very much.
I know there's questions, but something that just I'm thinking about with this is that even what we've been hearing from pain advocates and people living with pain is there is a very big difference of living in pain and living with pain, and the ability to be able, like if you want, when you're in pain, it's almost like it's front and center and it's right up close to you. It's and there's nothing else that I can see within my life when it's positioned like that, and the way that I would and this is metaphorical obviously, but the way that I would be working with my patients is finding ways that we can just create now the pain might be the same size, so if you want the same words that people would use, it might be the same intensity that they score it with, but how they orientate themselves relating to their pain or with their pain will be a little bit different. And you can already see if I'm holding my pain here, then I'm starting to open up space for other things in my life as well. So I think that like that to me is a sort of important, it's a key part of the process. And there are times when when the pain is so front and center, and the effect that has on someone is, particularly if they've been living with people, it's drained them of any of the resources that they have, and people are in a more vulnerable position when they come to see us often. So if we come back to what that means from a management perspective, I wouldn't expect pain to change, greatly to begin with, because we are just trying to put in place the processes that will make someone healthier, give them some well-being, and build up some resilience as well with them, that may or may not mean that pain does change, but ultimately will mean that they can start putting things into place in order for them to realize more fundamental change in the future. The time that then takes for each person will be quite different, won't it? Because, if you've been drained of all your resources and you don't have support in your life and pain is totally front and center, then that might mean that I'm much more of a sort of of a support than I am a guide and a coach. And how you orient yourselves there with your patients will vary over time.
Thank you, Tim. I'd like to just drill down a little bit further into that, because there's a very good question. There's been some great comments in the chat. Thank you, everybody. There's a great question from Bojan, and he says, someone may take living well with pain means either accepting or ignoring the pain. Is that correct?
And that's what you would need to check in with. Could someone take it like that? Of course they could take it like that. Yeah. And that, I mean, Bojan, you know very well what you say to one person and what they hear, it may be very different to what you say using exactly the same words to someone else and what they hear. So and even what from doing that, the motivator behind it as well. So yeah, I totally agree with you.
So Tim, I've got a question. Can I ask you a question?
Yes.
Okay, my question is that a lot of people that are in our world, for example, David Butler, Lorimer Moseley, Sandy Hilton, you know, loads of these sort of leading pain clinicians that we work with, both at NOI and through Le Pub Scientifique, they have this sort of phrase, and they say all pain can change. What do you think?
What do I think? Well, I agree. And actually, I've got to pay homage to Dave, because Dave, to me, was the first person who was saying, lift your expectations. Like, lift your expectations. We are not here in the process of just saying, let's live better with pain. Like, if we are living better with pain, pain will change. And then if we look back at where Lorimer and Dave, I think one of the influences they've had is bringing in the biology to understanding pain to the sort of lay person, where we're saying biologically there is complete plausibility that we will change. We are not the same people as we were 5 years, 10 years, 15 years ago, and we're certainly not going to be the same people in 5, 10, 15 years time as well. And if you look in the mirror, Joe,
I don't want to today.
we both know that there are changes on the outside. I mean, inevitably there's going to be changes on the inside, and that means, you know, that we are changeable organisms. We do change.
So just a little further with that question, how does that tie in? So if we believe and we're lifting our expectations, how does that tie in with that concept of pain management versus pain treatment, and how front and center is that for you in your clinic?
Yeah, I mean, at the right time and point, what we really are, we're creating the conditions for hope. And hope might be in a direct messaging of changeability, but hope might be building trust in yourself, your body, the decisions that you're taking, etc., that mean that you're living better with pain to begin with, perhaps. Yeah, so important, super important. I mean, for some people, it's fundamental. Come back to our patients, come back to our everyday experiences with our clinicians. There's not many patients that I see who most patients I see, let me rephrase that, most patients I see want to know if their pain is going to change. And to begin with, they might directly say, I want my pain to go away. But ultimately that's because it's so impactful. It's such an obvious thing that has reduced their life, their quality of life, that it's so obvious that needs to change in order for me to get life back.
Yeah.
But what people often see is that they can get life back, but pain hasn't necessarily massively changed. But certainly their life, the way they live their life, has changed and will change, and pain, I believe, can change in everybody. How much? I have to say, is very much individual.
I think that's a sort of great end to that session, really, Tim. Although I have got one little cheeky question in here that I think is worth putting to you. I'm afraid we're just not going to get to them all today. I do apologise. Please come back to the next session. We've had a very busy session today, so sometimes we have a bit more time. But I would just like to ask this question from Alexandra Clinton. Do you have any suggestions, Tim, of how to explain to patients the value of talking and planning? I'm often shouted at by patients for not doing real physio. Great question, and one that we get asked a lot, actually.
Yeah. Hey, so good to have you here, by the way, Alexandra. I mean, that's sad, isn't it, in the first place? And I've got to say, although I'm working entirely online at the moment with my patients, I'd love to do stuff where I'm doing a bit of body work and exercise and what have you. But although it would look very different, I guess, what I'm thinking of, what I'd like to do than maybe what someone expects when they hear the word massage or when they're thinking of massage. I mean, that comes down to setting out expectations for the session as well. And although it's not the same, obviously my background is that I'm a physio, so people, when they connect with me, I do explicitly say to them, this is how I work. Are you happy to work like that? And if they're not, and that does happen, then that's totally fine. I have no problems with that. And where I can, then I direct them to people that I think will be able to help them in the way that they want.
Thank you, Tim.
I gotta say this as well. Like, for some people, I mean, massage has been an effective thing in their life. Like, why bash massage? Although that might not be what you feel that you can give or want to give to someone at a particular point in time. But I'm thinking about Louis Gifford, that he would if someone's expectations is, you're a physio, I've come here for massage, and you have the skills to give them a massage, then it might be a nice way in for that person as well.
Yeah, thank you. That's a great answer. And all I would just say, in addition to that, Alexandra, is Tim's talked about this in more depth in other live sessions that we've done. You can find the whole library of these live sessions in the NOI Clinical Discussion Group on Facebook. I dropped the link in earlier. You will be sent the link again tomorrow as a follow-up to this session. So please do jump on in there. I mean, I think there's like 25 of these sessions in there now, Tim. They've all got a title. You can see what we were talking about. There's a tremendous amount of supplementary content in there that supports the Explain Pain course and understanding. So just to finish off today, Tim has got summer school, Explain Pain summer school, starting next week. So if anybody is interested in doing an Explain Pain course, this is a fantastic format that is actually proving to be very, very popular with the people who are in our community. And the course is delivered over 8 weeks, 8 2-hour sessions. They are all recorded, so it's the only course where the sessions are recorded, so you can join live or you can catch up on recording. And what you will find that is unique to this course is that you get extensive clinical mentoring with Tim. So we don't have time for all the questions in these sessions today, we just don't. And if you're interested in getting some sort of more one-to-one sort of quality small group time with Tim, then this is a fantastic way to delve deeper into Explain Pain, all the things that we've talked about here today, all the things that we've talked about in the other live sessions, and get the opportunity to really get some feedback about what you're doing clinically. So I think that starts on the 5th of July, Tim? Does it?
Yes.
I can't remember.
Yeah. It's next Wednesday, isn't it?
Next Wednesday. It's on the Noigroup website. Get yourself on there, log an inquiry, and we'll send you details for how to book your place. So thank you very, very much for joining today. We've had the biggest group we've ever had today, both in terms of bookings for this event and also live online. Thank you so much for joining. Thank you so much for your comments. Thank you so much for your questions. I'm sorry we can't get to everything.
We could go on for hours, but it's just great to connect with everybody, like almost in real life. Many thanks. And do join next time.
Sold out. It's not sold out, is it? Summer school.
What, the summer school? No, it's not sold out. But we're getting to the last few. So if you are interested in joining, log your inquiry on the Noigroup website. Nicola, who does the course management, will be in touch and send you details for how to book. But we're getting towards the end of the places now. I'm not exactly sure how many's left.
Cool.
Okay, guys. Thanks so much. Thanks for joining. See you next time.